Good evening and welcome to Arizona Horizon. I'm Ted Simons. The CDC's Advisory Committee on Immunization Practices meets this week to make recommendations on whether or not certain vaccines should be used and who should be using them. These recommendations go a long way in terms of vaccine costs and accessibility. And to learn more, we welcome Will Humble, Executive Director of the Arizona Public Health Association. Will, always a pleasure. Good to see you again. Thanks for coming. It's Advisory Committee on Immunization Practices. It's called ACIP. Well, what does it do?
For decades, it's been one of the most obscure committees in federal government. Now it's no longer obscure. It's people were talking about it on the show, for example. So it's a committee that looks at the various vaccines that the FDA licenses, and then they make a recommendation about what populations should get the vaccine. And the reason that recommendation is so important is because those recommendations are hardwired into other parts of state and federal law. So, for example, commercial health plans don't have to cover vaccines that aren't recommended by ACIP. They can, but the Affordable Care Act says if it's recommended by ACIP, you got to cover it, first dollar coverage, no copay, no deductible. Same thing with the Vaccines for Children program and Medicaid, our state access. They cover vaccines that are recommended by this advisory committee. So that's the pay-for side of things. It also is hardwired into state law because pharmacists, that's where people want to get vaccinated, at least adults get vaccinated, pretty much, they can only administer vaccines that are recommended by the Advisory Committee for Immunization Practices without a prescription. So you could look at it, this ACIP can affect things one way, who's going to pay for it and who's not. Also, who can administer it and who can't. And they never went through Senate confirmation or anything. Now, you remember, Kennedy dismissed them all and replaced them with his anti-vax friends.
Right. So with that in mind, I mean, how does the process work? How do they figure out what to recommend and what not to recommend?
I'm familiar with the process as it's been for the last few decades, in which they have advisors and experts that are on committees that study it in advance of the meetings. They do systematic reviews of studies, not just in the U.S., but around the whole world, really. Right. And they use that information. Traditionally, that's what's been used to make these recommendations. What this committee does, I don't know. This is the first time with this new cohort of people that's on this committee.
And we're not just talking COVID. We're talking RSV. We're talking measles, mumps, rubella.
The agenda Thursday and Friday. The meetings in Atlanta. They're 7-hour meetings Thursday and Friday. COVID is the one that has the biggest, because it has immediate impacts like today in terms of vaccine access. But also they're looking at the MMRV, which is measles, mumps, rubella, and varicella, that's chickenpox. Hepatitis B, that dose, the infant dose, the first dose, and then RSV. So all those could all change.
Okay, if they do change and you can't get it at the local pharmacy and you don't get the insurance all changes, what does that mean? What are the ramifications for public health?
That's why Governor Hobbs did her executive order last Thursday, to try to find a state workaround so that folks who are under 60, I think the committee's going to keep it for 65 and up. Mm-hmm. I think they're going to keep that recommendation. But they may make it much harder for people under 64 to get this vaccine. So that's where Hobbs's executive order comes in, where it charges these 3 state agencies, the state health department, to do a standing order, which stands in place of a prescription. Then the pharmacy board to give pharmacists comfort that they can use that standing order in lieu of a regular written prescription. And then the Department of Insurance and Financial Institutions to compel the health insurance plans to cover it anyway.
So that's what this state is doing. Florida is doing something just a little bit different here. No vaccine mandates for kids?
Well, that's what their Surgeon General, they call their health department director Surgeon General. He made a statement last week, we're getting rid of all of our school vaccine mandates. Well, they haven't done it yet. He has to go through like a year-long administrative process to change the regulations. So he says he started that, and will he finish it? I don't know. But over time, that will obviously put the kids in Florida at higher risk. And by the way, risk outbreaks at places like their Sentinel what are they, Disney?
Yeah,
whatever it's
Disney
called.
World. Yeah, I was going to say that. What about people wanting to go visit down there? Again, the public health ramifications of such a move. Take it a year out, whenever it becomes effective.
Right. The people that will be at highest risk will then be the kids of parents who's chosen not to vaccinate their kids. And importantly, there are kids who have medical exemptions, like they can't get vaccinated because of an immune system problem or something. Those kids they also are at risk. Their parents can't vaccinate them. And that's the whole idea behind herd immunity, which is you vaccinate everybody that you can except for the people that you can't, and in that way you can protect them.
There's increasing confusion. It seems to me that there's increasing confusion, I'm hearing about this, regarding who is eligible for COVID vaccines, who is not eligible, where do you go, where do you not go. It seems on the surface here, Will, that people just don't know what's going on.
Correct, because there's no answers. I mean, by Thursday and Friday, we'll have a better idea, because we don't know what that committee's going to do in terms of the advisory committee for immunization practice. They're going to make some recommendations Thursday and Friday. Depending on what they do, then we can start figuring out what we want to do. Also, pharmacies are like, we're not buying anything right now,
right,
because we don't know what this committee's going to decide. And if we order a whole bunch of vaccine that our pharmacists can't administer, then we're sitting on inventory we can't move.
Didn't CVS just get out of the vaccine business altogether, or close to it, or at least as far as certain vaccines?
I think it's all suspended.
It's suspended.
Waiting
okay.
this meet, because they're making multi-million-dollar business decisions in an environment where there's this advisory committee full of anti-vaxxers that are going to be making these recommendations that tie directly to the product that they buy and that their pharmacists have been used to administer.
Are people right now not getting vaccines and getting vaccinated because of this confusion?
I think they're beating their head against the wall. A lot of people want to get the COVID-19. It's available. The new updated vaccine is ready. But it's really hard to get because people aren't ordering it because they don't know what this committee is going to do. And we also haven't seen the effect of the governor's executive order with respect to the standing orders, can pharmacists administer, and will the health plans pay for it?
Okay, you got the pro-vax crowd, you got the anti-vax crowd, and all points in between. If any side is not happy with what this committee could say, give the thumbs up to all of them, and the anti-vax crowd is going to go nuts. Same thing if they give the thumbs down, the pro-vax. Is there any what do you do if you're not happy with that result?
It's Secretary Kennedy. I mean,
so basically, he's the stop. He's the goalie here.
And the strategist.
Yes. He's the head coach, the forward, and the goalie.
And that's the thing. This advisory committee has been around forever, many decades. And when the Affordable Care Act came in 2010, they hardwired the Affordable Care Act provisions into this committee, not anticipating that 15 years later there would be somebody like Secretary Kennedy making decisions, putting people on this committee that aren't qualified.
Yeah, for my hockey fans, I meant winger, not forward. But we all know what. Okay, last question here. Are COVID cases right now in Arizona on the rise?
Yes.
Why? Is it the new strain?
It's these new variants, the Nimbus and Stratus, they're called. I don't know why they named them that. They're still in the Omicron family.
Right.
Because they've mutated just enough to escape the immunity from previous infections and previous vaccinations. So those are on the rise. But I don't want to make it sound like this is 2020 and 2021. It's not like that.
Right. But and these variants aren't as nearly as serious as the past ones?
We talked about this on the show.
Yes.
Viruses, all they want to do is make new copies of themselves. They just want to reproduce. How do you reproduce? You have to trick your host into making more virus, and it doesn't help if you're killing your host. So over time, viruses get less lethal and more contagious. It's natural selection.
Crafty viruses, aren't they?
It's natural selection.
Will Humble, Arizona Public Health Association. Good information. Good to have you here.
My pleasure.